We're thrilled that you have joined the Treatment and Recovery Resource Meeting. This meeting is a product of the Treatment and Recovery Committee for the Governor's Alabama Opioid Overdose and Addiction Council. These virtual calls are designed to provide valuable insights, resources, and support for professionals involved in helping someone gain access to treatment and recovery resources. Each meeting will feature 3 dynamic speakers representing different organizations who will share the resources they have available to support our important work in the field of treatment and recovery. These meetings will occur on the first and third Wednesday of every month at 12 p.m. So please continue to join us as they occur throughout the year and feature new agencies with each meeting. The Zoom link will remain the same for every meeting this calendar year. Each agency will have 15 minutes to share about services and referrals, followed by 5 minutes for any questions our attendees may have. We ask all participants to remain muted during the presentations. When we open for questions and answers, you may unmute to ask your question, or you may also type it in the chat and we will ask for you. Without further delay, I'm excited to introduce that our 3 agencies for today are Kolbe Detox, Starting Point Outreach, and Foundry. So we will begin with Katen with Kolbe Detox.
Good morning, everybody. It is an honor and privilege to be on this Zoom call. I am Katen, and I work with Kolbe Detox. I'm the outreach and marketing. I'm also a person in long-term recovery and a peer support specialist. With our Kolbe Detox, we have 2. One is in the Laverne Community Hospital, which we've had that for 3 years. And then the other one is in the Tallahassee Community Hospital, which we've had that for 5 years. We also are at a 3.7 level of care. We take almost all insurances. We haven't been able to start taking the Ambetter insurance, but we do take the Medicaid and Medicare. We also provide transportation, which our transporter, she is a peer support specialist as well. So they get that constant contact and, that one-on-one immediately when they get into the car. We also offer our scholarship grants. Sometimes our patients don't have insurance or something, but they have to, there is a different, it varies through each patient. Sometimes they can't qualify for it. Sometimes our scholarship grant has ended for that month. We met that that reach of the scholarship grant, which in turns, I normally reach out to them because I'm a person in long-term recovery, so I have other resources that I could provide them and just meet them where they're at over the phone. We're a 3 to 7 day medical inpatient detox. We are in the hospital, so it's a hospital setting with nurses. So if they have like open wounds, they are able to come to our detox still because we have nurses on staff. We can extend the day. It all depends on insurances or, what they're detoxing from. A lot of times methadone patients that are trying to get off the methadone take a little bit longer. We also have licensed social workers on each unit. So when our patient is there, they can get a psychosocial done, they can get their ASAMs done. And so the social worker will start a discharge plan for further treatment because, 3 to 7 days isn't long enough for some people. They need that first start to detox medically and then go to a different level of care after that. We also have a number that I can put in the chat for intakes. And I can put my email address and other things as well. Does anybody have any questions?
I have a question. If somebody's not in one of those two communities where your detoxes are at, how would they be able to reach y'all? Just via the website, or what would be the best way to kick off that initial process?
Are you talking about like such as transportation?
Just to start seeking your services, whatever that looks like for them. Whether transportation was not really what I was thinking. I was just really thinking of the detox service. So can they come to one of those locations, even if they're not in one of those communities?
Oh, yes, sir. I mean, we've had people all the way from Georgia come all the way to our detox center. It doesn't matter which, community you're in. We've had people that had beds ready for them that are in totally different, counties or cities. And we were able to get them their detox before they could go into their treatment.
How many beds do you have in each of those facilities?
Good question. Sorry, I should have mentioned that. Okay, so our Laverne one, we have 5 beds, but we are also connected to the hospital, so we could use one of their other beds, for overflow. But in the Tallahassee, we have 3 beds, and the same goes for that. Since it's a hospital, we can use their beds for overflow.
Does anyone else have a question for Caton with Kolbe Detox? All right. Thank you so much for sharing and taking the time to share your resource with us today. If anyone thinks of a question, feel free to put that in the chat at any time. Again, thank you for sharing. And at this point, we will move on to starting point outreach. Do we have anyone from starting point on the call? All right, that's okay. We have Jeff with Foundry that we will move on to.
Is everybody good? Caton, great job. Loved hearing everything that y'all had to offer. Super excited to be on here. I want to give a special shout out to my good friend Judd Drake. We've been friends for a while. Just a super, super amazing individual and super amazing advocate for people in long-term recovery. So my name's Jeff Gilliland. I'm a person in long-term recovery. I work for the Foundry Ministries, which in essence has 3 locations. We have the location in Bessemer, which is the men and the women. The men's facility in Bessemer roughly holds about 80 individuals, and the women's facility about 30. And I have the opportunity to work at the Foundry Farm in Coleman, Alabama. We have about 65 acres up there. It's just a different dynamic, different culture up there. We can house about 70 individuals. And we just provide recovery services. We are a faith-based nonprofit. We don't provide clinical services. We are a long-term residential program, so our program consists of time frame 9 months to graduate. So what that looks like is 6 months residential and 3 months non-residential. And for those 6 months, while they'll be in our program, they will be doing anything from having pastoral counseling to case management, where we're communicating to for people that have legal situations going on, to attorneys, to judges, to probation officers, parole officers, and things like that. And we also provide recovery education just to try to help the individuals be as equipped to navigate the recovery community whenever they depart from us. And we also have an employment readiness aspect to where we have the program specifically set up into two different groups, an A and B group. And what we do is 1 week, just say, for instance, it's A group's class week. They'll have nothing but classes and things of that nature that week. And then the next week, they'll engage in the employment readiness side of our program. And for us, we have a couple of thrift stores in the state, and that's where guys will, the men and women will go, and they will just kind of help out at the thrift stores and things of that nature. And then the fifth component of what we do is aftercare, and aftercare consists of from when the individuals at month end of 6, they will transition to either a sober living facility, a transitional living house around the area, but they will still be in our aftercare program. So they'll still have monthly drug screening and access to pastoral counselors, and they will have certain requirements about staying plugged in to faith-based initiatives, some kind of church services. We try to get them involved in local church organizations, and as far as some kind of recovery service, whether that be a Celebrate Recovery or just really anything, whether it's AA, NA, CAHA, just kind of whatever they want to be involved in. We just want to support that and encourage that. But I guess if I could take a step back real quick, I want to talk about a really cool program that I feel like is super, super beneficial that we offer at the Foundry. And then we have a ministry partner, which is called Hope Inspired Ministries. And Hope Inspired, they came on and started their program in the Bessemer location before we rolled it out in Coleman at the beginning of 2023. But my wife actually works for Hope location, so it's really cool. She's my boss at home and at work and all that good stuff. But anyway, they do employment readiness, they do career development, workplace etiquette, resume building, and things like that. So it's just really cool because I'll teach curriculum at the Foundry Farm in Coleman, and then she'll teach the men during the day as well. So that's just really really some amazing things that we offer up there. Our program Foundry as a whole has been operating for pretty much over 50 years now, just providing services from meals to residential recovery to thrift store services. And really, I guess as far as what it looks like for us providing services in the state, we're really statewide, and really all surrounding states actually, refer to us as well. We have individuals that come from Madison County up around Huntsville all the way to Baldwin and Mobile County. So we're kind of statewide. We do not offer levels of care. We're not a clinical program. We are a just recovery services. We provide recovery services. And for me and for us at the Foundry, some of the best practices for referrals and admissions are if someone can just go, and I'll put this in the chat box as well, just go to foundryministries.com, foundryministries.com, and they'll give, it's real easy to navigate. They will be several opportunities to where you can apply for the women's program, the men's program in Bessemer, or either come to our Foundry Farm program in Coleman. And what that does is once the individual or caseworker or social worker or whoever that might be, or either their parent, or loved one, they fill that application out, it automatically triggers an email that is sent to someone in the program office, and we will reach out within 24 hours to try to see, if it is going to be something that will be a good fit for the individual. The one thing that I feel like we pride ourselves on is there's no competitors in this thing. We're not, trying to compete with other people. I know for me personally, I want to offer the best level of care and offer the best services for that individual. And if it looks like that they might not be a good fit for our program, there are some stipulations with the MAT that we do provide at the Foundry. So if it looks like they might need either a higher level of care for mental health medications, or whether it's some different MAT options, I just always want to do a warm handoff and try to connect them primarily with maybe the Recovery Resource Center or either definitely at least connect them with someone from Ross so that we can just make sure that these individuals are getting the best care that they need. Because they sometimes, when I'm a person in long-term recovery, so I speak from personal experience. In the height of my addiction, when I'm trying to reach out for treatment, sometimes I don't always, I can't always communicate exactly what I need. So that's why it's always good for us as organizations to have strong people that can help the individual navigate what they're trying to get for their lives. And I will say this: we are always looking for options for detox. So it's really cool to hear from you earlier, ma'am. I know the detox is kind of like the Willy Wonka golden ticket for the state of Alabama. When we find a golden ticket, we really want to try to cash that in. And I guess as far as that's really kind of what we offer, I do want to, I guess, briefly mention this. A really cool service that we offer at the Foundry Farm is we have a really good relationship, and we have a partnership with UAB School of Nursing, with Dr. Bowers and Dr. Patton down there, and they either come up to our facility every Thursday evening, or either do kind of Zoom telehealth with our participants in the program, and just offer medications free of charge, that we can kind of help facilitate while they're there. And also, we have a pretty good working relationship with UAB Beacon, as well as UAB Center for Psychiatric Medicine, and we will refer to those agencies when there might be some psychiatric needs that we just might not be able to facilitate. But I know that I kind of probably talked really quick, but I'm super stoked to be on here, and it's just really cool to see some familiar names on here, because we're all trying to. All of our goals are, we all have the same end goals, and they're all just to help and love on people and help encourage, and really at the end of the day, just keep people alive, and show them a fullness of life that maybe they've never experienced. But with that being said, does anybody have any questions or comments for us as far as the Foundry Ministry? Something maybe I left out?
Hey, Jeff, sorry I'm not on camera, but I'm on the beach and I didn't want to rub it in.
Oh
Uh,
man, oh Judd, you better send me some pictures afterwards though.
uh, my question is though, do y'all have peers at all your campuses now?
Yes, yes sir, we do. We do. We do have peers at all of our campuses now that provide recovery support for the individuals that are in our program. And we have really good working relationships with many other peer organizations too. So really, when they finally get ready to phase out, is what we call it, when they go non-residential with us, we try to make sure that they are as equipped as possible, that they have several different peers in different locations wherever they might be going, whether it's back to mom's house, or they're getting an apartment, or they're going back with their wife and kids, or whatever that looks like. We try to give them as many resources as we can. And we even do that for individuals that might even be dismissed from the program, or that might leave prematurely. There's not any animosity. We just, when somebody leaves our program, if they feel like it's not going to be a good fit, we just want to still send them out with the Narcan kit. We want to still try to encourage them to reach out to some outside organizations. I have information for the Recovery Resource Center and for Ross that I'm consistently giving out for individuals that are leaving our program prematurely. Thanks for the question, Judd. Appreciate you.
Does anyone else have a question for Jeff? Jeff, we appreciate you taking the time today to share with us.
Thank you. Appreciate y'all having me.
All right, so if no one else has a question, we will move on to starting point outreach. Looks like they were on and then maybe got disconnected. We have someone connecting to audio, so let's give them just a minute and see if that is our rep from Starting Point Outreach. Do we have someone from Starting Point Outreach? Right, it does not look like they are on the call. So at this time, since we have an extra few minutes, Kaiten or Jeff, is there anything that you would like to share in addition? Or you think you got it all covered? I know we gave you 15 minutes, so that's why I'm like, if there's something else you want to share, please feel free at this time to do so.
I actually did forget something. During each day that our patient is at our detox unit, we also provide either activities or a support group, just to help them to, communicate and just get out of their room and everything. We have an activities room and it has a TV and everything, but our workers that are either activity techs or peer support specialists. And then we also will have the social worker as well. But I meant to mention that earlier.
Yes, thank you.
I guess I would just like to add that, sometimes people are, they think, well, I don't know if they're going to be a fit for the Foundry Ministries. And, even if you don't want to take the time to fill out the application, you just want to reach out to us. I put the website foundryministries.com, and I also put my personal cell number down. So please feel free to give me a call anytime. And, we can just kind of talk through some stuff, because at the end of the day, if you have someone that they might not know exactly what they really want to do, and I would love to try to help connect them, even if they don't come to the Foundry. I really, the longer that I do this, I think the more that I realize that, literally we are better together, and there's not competitors in this thing. We're all trying to do the same thing, and as a pastor, as well as a peer support specialist, and as a worker at a faith-based agency, as a pastor, my eyes are open differently, because I don't just sit behind a desk from somebody and communicate to them. I also get the privilege and honor of officiating funerals of people that have overdosed and passed away. Their families reach out to me. So when I say that, it's just my mindset has changed from the way that it used to. I feel like everything I do in the recovery scene is different now, because since 2016, I've probably officiated right at about 116 to 118 heroin opioid related funerals. And it's just something that I just really am so passionate about, just connecting people with local agencies that can meet their needs, even if they don't feel like they're going to be a good fit for us. But I really appreciate y'all's time, and thanks for letting me share. It was some great information.
Thank you both for sharing today. One last call to see if we have anyone from Starting Point Outreach. I don't think we do. All right. So again, thank you for joining, and we hope you were able to learn something new about a resource available to you in Alabama for treatment and recovery. So please join us on July the 3rd for our next virtual meeting. Just take note that that is almost close to a month from now, we will not meet on the 19th due to it being a state holiday. So again, our next meeting will be on July the 3rd, and I hope everyone has a great afternoon. Thank you again.